5 commonly used medications that are safe for use during pregnancy. Hi, I'm Dr. Fatu Forna. I'm an OBGYN who works to keep pregnant women safe here in the US and around the world. So, one of the most common questions we get as OBGYNs is, what medications are safe during pregnancy? Is this medication safe to take? We love that question. It's good to ask because any medication you take could potentially affect your baby. So it's good that pregnant women ask these questions. We want you to ask them because we want you to make sure that you're not taking any medication that could potentially harm your baby. What you do need to know that is no medication at all is 100% safe. There are medications that we're more comfortable with. We've used them a lot. We know that overall we think they're safe. We've done studies, but we can never give you 100% guarantee because there could be studies done in the future that shows there's a problem. However, despite this, we do know there are medications that we use all the time that we think are safe during pregnancy. But it's important that you always check with your doctor before taking any medication at all during pregnancy. So number 1, prenatal vitamins with iron. Prenatal vitamins with iron, they include folic acid, they include all the little minerals that you need, to make sure that the baby is growing normally. It helps to prevent birth defects. It helps to prevent anemia. We're pretty sure prenatal vitamins are safe. We've been using them for decades and decades and decades. So relatively safe prenatal vitamins, iron, folic acid, relatively safe. All right. Number 2, Tylenol, also called Acetaminophen if you're using the generic version. Usually recommended for pain and fever during pregnancy. We don't usually recommend that you take Motrin or ibuprofen because that can cause problems with the fluid, the amniotic fluid around the baby. But Tylenol, we think it's relatively safe. There has been some controversy before around whether it's linked to autism. The American College of OBGYN and other scientific societies, they've looked at it. They've looked at all the studies. They have not been able to find a clear link. That's why we think that Tylenol is safe during pregnancy. Number 3, Antacids. I'm not sure if I'm pronouncing it right. My accent is coming through. Antacids like Tums, Mylanta, stuff that you use for heartburn, that's relatively safe during pregnancy. They contain calcium. They help to kind of neutralize that acid. I know when I was pregnant, I was popping Tums because I could barely eat. I had all this discomfort. So we think they're relatively safe. Number 4, antihistamines. We know that Benadryl, the generic name is diphenhydramine, relatively safe during pregnancy. It's the most commonly used. And because we have a lot of experience with use, we recommend it. It can also help with sleep. Sometimes if you can't sleep, it's okay to take a Benadryl here and there, not every day, but talk to your doctor about that. And then number 5, the cough medications. Cough suppressants like Robitussin, they are safe. Expectorants like Mucinex, the stuff you rub, Vicks, most of the cough drops, most of those, they're all considered safe during pregnancy. So those are common medications that I'm sure you might have questions about during pregnancy. These are the ones we have a lot of experience with, but it's important that you check with your doctor before taking any medications, including the ones I've talked about today, because again, I'm not your doctor. I can't give you specific medical advice because I don't know your specific medical information. I don't have access to your chart and your full medical history. So it's good to always ask your doctor. But we do have a lot of experience using these medications, and we want you to ask about medication safety before taking anything during pregnancy because we need you to survive and thrive.